Soframycin skin cream. Framycetin skin cream. Soframycin is the antibiotic of choice for the treatment of skin infection and burns in which secondary infection readily occurs. The chief advantage of soframycin is its wide range of action against gram-positive and gram-negative organisms such as Staphylococcus, including strains resistant to other antibiotic Proteus species, Pseudomonas aeruginosa, and the coliform organism. Recent observations have shown that prevention of infection with an antibiotic resin such as soframycin is indispensable even in appreciably superficial scald or burns. In order to avoid more extensive loss of skin and ugly keloid formation which might occur if infection supervenes. Soframycin further qualified as the preferred antibiotic for topical use because it has a low sensitivity potential and it is exclusively employed for topical therapy. In principle, antibiotics which are administered permanently or orally should be avoided in the role of topical agent. For hypersensitivity might be included with erupts on systemic employment of the antibiotic on a subsequent occasion. Composition. Soframycin skin cream contain 1% soframycin in an excipient of the penicillin cream type and is fully miscible with water and exudated. It combines the advantage of an ointment and a lotion. Indication: burns and scald of all degrees and severity, wounds, cut and ulcers, primary infections such as impetigo, folliculitis, schistosis barbae, otis estrania, furunculosis, paranoia, secondary infection of cuts, scratches and wounds, scald and burns ulcers, eczema, contact dermatitis, atopic dermatitis, seborrheic dermatitis, prevention of surface spread of infection and eradication, cutaneous reservoirs of Staphylococcus aureus. The organism can be cleared from the anterior areas by the daily application of soframycin skin cream. Mode of application: in the prophylaxis and treatment of infection burns, apply soframycin skin cream generally and cover the affected area with sterile gauze impregnated with petroleum jelly. In the absence of infection, the dressing can be left undisturbed for 2 to 3 days. In skin infection, wash the lesions with taped saline to remove scales and crusts. Then spread soframycin skin cream upon it and cover with a sterile resin. The application should be renewed 1 to 3 times daily. Presentation: tubes of 5 gram, 20 gram, 100 gram. The collapsible tube pack of soframycin skin cream plays an important role by ensuring the protection of the contents against contamination, since successful therapy of burns and wounds largely depend upon barricading all possible sources of supervising infection.